afternoon, Dr. Chua. It's an honor to welcome you at NIOS, that is held by Netaji Subhash Chandra Bose Cancer Hospital, the International Onco Summit. Thank you for joining us to contribute to this important focus on gynecologic and genitourinary malignancies. So, sir, I have certain questions for you. You have a vast experience in oncology, right? So, how do you see advancements in your field of expertise influencing the treatment of this gynecological and genitourinary malignancies? What is your focus of the summit?
So, first of all, thank you for the invitation. I'm embarrassed to say, it's my first time in Kolkata, and it's been a very good, strong first impression. Beautiful city, very culturally rich. I'm a clinical oncologist from Singapore, practicing at the National Cancer Centre, Singapore, and my specialty is in head and neck cancers and genitourinary cancers. And specifically, I think the focus of this meeting would be on genitourinary, where I have a lot of interest. I think it's exciting because there are so many advances in the field of prostate cancers, bladder cancers, and kidney cancers. I think these advances are important because we know that globally, these three cancers are rising in incidence.
Yes,
for example, prostate cancers, is pretty much the number one male cancer, similar to what you see in breast cancer. So I think in that sense, there's been a lot of movement trying to, number one, improve the way we treat, making things more multidisciplinary, in the hope that we can improve, bring more cures for patients and also improve their quality of life. So to me, coming to this meeting, it's a very important opportunity for myself too, to learn about what are some of the practices, in this part of the world, where trials are being done, how do the teams connect to each other. I think all those things allow me to have many experiences that we can share.
All right. How do you think global conventions like NIOS contribute to advancing oncology research and treatment, particularly in your area of experience?
I think there are many meetings, every year. We have the usual sort of big meetings where, like ASCO, ESMO, we have 40,000 people going to it. And the purpose of those meetings are a bit different. The way I see meetings like NIOS is that, you have it in India, and where, it allows cross-exchange of experts within India and also outside of India.
Yes.
And I think this forum is extremely important because then it gives people another opportunity to learn from each other.
Yes.
Now, I think advances, you can talk about advances that can come from a big trial, a new technology that may seem, intuitive or easy to implement, but in reality, there are several implementation barriers. And I'll speak about that in my talk, that something that has, is advanced technology, it is helpful to patients, but in essence, doesn't actually reach the community or the specific population. So I think, things like this are important dialogues for meetings like NIOS.
Okay. What unique insights do you think Southeast Asia's approach to oncology brings to the global conversations on gynecological and genitourinary malignancies?
Oh, it's a very pertinent question. The way I see Asia is a melting pot of different cultures, different demographics, and importantly, I think it has different income status. And so for that, all these things are important factors in terms of governing what are the treatments that are accessible to patients. And so you will come to appreciate that, especially in Asia Pacific, everything is heterogeneous. A practice in Singapore may not be the same practice in Thailand, and certainly won't be the same practice in India.
Good.
But there also are the commonalities as well.
Yes.
So I think that bit is very important. So it's not about what I'm doing is right or what you're doing is wrong, but I think it's about mutual
Learning
sharing.
from each other.
Yeah. For example, like in prostate cancers, India has been a leader in terms of pushing molecular imaging, advanced imaging, and staging and treatment of prostate cancers, while the rest of the world fell behind in the form of PSMA PET, because PSMA PET scans were, very widely accessible at a very low cost to patients, and so it has allowed this advance to really, be diffusely practiced, in various parts of the communities, while the rest of the world were catching up. So in that sense, this is an example of how we could mutually learn, where things that are done a lot quicker, a lot ahead of time in India can be shared, with the rest of the world. I think that's very important. Yeah.
Okay. Netaji Subhash Chandra Bose Cancer Hospital, our hospital, it is going to launch a journal, and the name of the journal is called Praxis Oncology. So what is your view on it, or what views you would like to share on this?
So I think, first of all, it's a great effort. It's a form of academic sharing. But I think what is also important is for the hospital, for the journal editorial board to be very clear about what is the goal of the journal. What would you like the journal to do? Because currently, in the field, there are hundreds, thousands of journals, each of which carry a different level of visibility and impact. So I think the goal of the journal should not be overly ambitious. It should have a very singular focus to, number one, promote research within the hospital. Number two, use it as a forum to share important articles or important work from the hospital with the wider community, and cater to very specific communities, where they may not have access to research, access to trials. And so as a result, you form a network of education, research, so that everyone can sort of increase their level of competencies. That would be, if anything, that would be my, most important and crucial advice to the journal. Yeah.
Okay, thank you so much, sir.
Pleasure.
And one more question I have. What insights or collaborative efforts do you hope to take back or establish from this NIOS summit to further cancer research and treatment in your specific areas?
I think that's a great question. And my simple answer would be to create more friendships and networks. I came here because of a friend, and we met at a meeting in Singapore. Part of the reason why I like to travel and give talks, apart from visiting the city itself, is to recognize that the world is a massive oyster. And there are many, many things that we could work together, and we're only stronger as a community. Sometimes this cannot happen fast enough because, in the elephant in the room in the academic world is that there's an ivory tower. Everyone wants to be at the very top. And sometimes I feel that really the issues that the broader community face are often ignored, or there's a devoid of opportunities. And so, part of my endeavor when I travel is to deepen friendships, to know more people. You only know that by coming to the place, interacting, seeing what's been done, and you all go in with a very open mind. So then you take as much back as much as you try to give back in return.
True.
And for me, I think that is the most fulfilling, and from there, things will grow because I've been here, I've met the people here, and that's how, your network broadens. So that's really my goal.
Thank you so much, sir. We'll learn from you, you learn from us. That's how we'll grow.
Yeah.
That's
absolutely.
Okay. Thank you, sir. Namaskar.
Thank you for the interview. Thank you.